Tell me, are there different kinds of ear tubes?
There are. Their materials are different. The shape of the tube is different. There are tubes that are plastic or surgical plastic, some that are titanium. There are some that are designed to be short-term and some that are designed to be long-term ear tubes.
What's the procedure like? It would seem to me like putting in an ear tube would have to be, really, really careful, and it might hurt somebody. The ear's tender.
It is a microscopic surgery. We do it underneath an operating microscope, so you have high-powered binocular vision. But it's a very easy procedure to do. In adults, we do it in the office under a local anesthetic. It's a very easy thing to do. In kids, it's hard to get them to lay still, so most of them require an anesthetic to have it done. But the procedure itself, to put 2 ear tubes in, probably takes less than 5 minutes.
So tell me, why do you put ear tubes in? When are they needed?
Well, we talked about the eustachian tube, and in kids, the ear tube is a small, open, bobbin-shaped tube, essentially, that has a central open port, and when you put it in the eardrum, it allows pressure to equalize through the eardrum out the external canal. So it mimics the eustachian tube. And so in kids who have recurring ear infections secondary to eustachian tube dysfunction, the ear tube allows them to equalize pressure. And a simple set of ear tubes can stop the recurring infections that plague child and parent both.
So it's something that may frighten the parent, but after they get it in, it just is like gold because their children don't have those infections.
Of all the things we do, and as simple as it is, the impact is probably the greatest.
Now, when I look in somebody's ear, sometimes I'll see they have an ear tube in there, and frequently they're pretty colored little plastic tubes that are inserted into the eardrum. How long do they stay in? Do they fall out by themselves? How do you keep them in? How long do you want them in?
Once the ear tube is in place, the average one will stay in about a year. And it falls out on its own into the ear canal, and the hole that was in the eardrum typically heals very quickly. While the ear tube is in, it's a common misconception that you can't get water in the ear because you got a little hole in the eardrum, but the holes are so small that unless the person's going to be more than 4 feet underwater, there's not enough pressure in the water to force the water through the ear tube into the middle ear, leading to a secondary infection. So it's really nice for parents to know that this is a relatively seamless procedure for their child. If they're going to dive deeply into the pool in the summertime, an earplug may be indicated, but otherwise, bathing, showering, superficial splashing around the water doesn't need to be a worry after a set of ear tubes.
If the tubes have been in there for an ear, do you remove them yourself? You let them stay there? How long do you determine how long they're in?
You let them stay. You don't want an ear tube to stay in for more than 3 years because at that point the statistical likelihood of a permanent hole in the eardrum increases. Now there's some ear tubes that stay in permanently. There are some of my children and adults who have lifelong difficulty with their eustachian tube. It's not reversible. There's not a procedure that we can do to stent the eustachian tube open or to close it off that will be effective. And so they require ear tubes forever. And we use a special ear tube called a T-tube that has a longer flange that goes behind the eardrum that keeps it from coming out. And we'll leave those in indefinitely.